The public health sector is strained as healthcare workers battle the COVID-19 pandemic in the country. In the Eastern Cape, the situation is said to be critical, with hospitals filled to capacity and a shortage of beds reported. It's estimated that at least 10 people are dying daily from the virus in public hospitals in the Nelson Mandela Bay area. Aviwe Mtila is up and about, and he's been checking the situation on the ground in the Nelson Mandela Bay. We have Monique Motlok as well checking the situation for us on the ground in Cape Town. But first, let's begin with you, Aviwe Mtila, in the Eastern Cape. I understand you visited a couple of hospitals and you've seen that there's big challenges when it comes to capacity.
Certainly, Bradan, an exclusive look inside the Nelson Mandela Bay public hospitals, and it's quite concerning. Government says they've done all they can in preparation for the second resurgence of COVID-19, but all those efforts are falling flat because of the behavior of the people they emphasize. The hospitals, the casualty wards where patients are received are full to capacity, and these are public hospitals where patients can't be turned away, so they have to take in those patients anyhow. You'd find patients on the corridors. The mortality rate is more concerning, with 50% of people that go into those casualty wards passing away. Those in ventilators, 80% of them also don't make it out. A real concern, Bradan, that has prompted even 3 ministers a visit that is coming, that will happen during this week. Minister Zweli Mkhize, Minister Lindiwe Zulu, as well as Dr. Nkosazana Dlamini Zuma, expected to join the MEC just to tackle this resurgence of COVID-19 in the Eastern Cape. But I want you to look into an exclusive look that we had inside the hospitals of Nelson Mandela Bay.
At the moment, we are completely full. We do not have any oxygen points.
Yesterday, we had over 20 patients in a ward that should have had only 8.
The reality of casualty wards in Nelson Mandela Bay's public hospitals. But what's even more alarming is the mortality rate. A COVID-19 patient is being resuscitated over here, and just meters away beyond those curtains, one patient has passed away.
80% of the people who go to ventilation in ICUs, we lose them. We lose half of the people who come to our wards.
One of the examples, we had a lady, we had no beds or stretchers available. She passed away in a wheelchair, sitting in amongst a crowd of people in the respiratory area. There was a 13-year-old boy lying in the bed next to her, and another lady lying in another bed right next to her, also watching it as it happened.
The ripple effect of COVID-19's resurgence in the Bay can be seen in the increasing numbers of staff who are testing positive or showing signs of fatigue.
I saw a message now in our work group. I think the whole nursing team in neonatal ICU has tested positive. So that's an entire nursing team in an ICU that has to now be quarantined for 10 days.
It's extremely difficult for staff to stay in PPE and also to keep motivated. There's a very high burden of patients who are passing away and who are suffering, and it's very difficult for some of our junior staff to carry that and to carry that burden. So we actually need fresh legs.
A shortage of oxygen only adds to the endless woes of public hospitals.
In total, if you count everything together, we only have 26 spaces on this floor. So we have to sometimes make quite difficult choices. In our A&E side, we've been able to split the oxygen points so that we can provide more oxygen to patients coming in.
While the Metro has put measures in place to mitigate the impact of the second wave of COVID-19, these are proving useless against the behavior of residents.
COVID is real. COVID is dangerous. COVID can kill. On a daily basis over the past week, we had in excess of 10 deaths per day. Day before yesterday, and this is only hospital deaths. Day before yesterday, 20 people died in our hospitals across the Metro.
These deaths may happen in hospitals, but many don't happen in hospital beds. Public hospitals are caught between a rock and a hard place. Even though beds are full, they can't turn patients away. The sad result is that many pass away in the corridors. Aviwe Mtila, Port Elizabeth.
Avi, we're still with you there in the Eastern Cape, listening and hearing that report that you've done after you visited those hospitals there in Nelson Mandela Bay, and hearing authorities warning that we need to change behavior because we could be faced with a COVID-19 second wave. We are seeing numbers of over 2,000 new cases in the past 24 hours being reported. Did you get a sense that people on the ground, the authorities in those hospitals, the management in those hospitals are aware of this and they're really trying their best to resolve the challenges they are facing?
The behavior of the people is at the center of the second scourge, brother. And you'd drive around the town, Summerstrand and Port Elizabeth, go into the townships, Motherwell, visit just in passing by at these super spreader events they call the taverns. You'd see them packed, no social distance, you'd see no masks been worn, you'd go into the retail areas, concerning scenes there. Hence even why we got this exclusive look. Government saying that we've done all we can at this stage, in fact, just to alarm residents out there about the second scourge. We've gone out with hailers, condemning their behavior, even the MEC Sinswak, my health MEC, saying that the people even, they get nasty remarks when they put this across at them. But of course, this is resulting in what you just saw, the replications of it all, resulting in those hospital beds being full. So awareness needs to be done, in fact, just to spread the message that COVID-19 is real, as the district manager put it out. And in fact, on the day that we interviewed her, 20 people on the previous day had passed away from the hospital, a real concern in Nelson Mandela Bay.
It's a big concern indeed, as we see some numbers in Eastern Cape going up, and who knows what the authorities at the national level are going to do now. Thank you very much, Aviwe Mtila.